Are we missing the point here? Does not yeast infection occur because there is an imbalance somewhere? Shouldn't we get at, aren't we dealing with the symptom rather than the real problem?
Good point.
Shouldn't you get at, shouldn't you get at where the imbalance is rather than the
Not only an
secondary?
imbalance, one thing we haven't talked about, Harry, we need to, because some of the skeptics, and we may talk about it later, one of the major American allergy organizations that I belong to, the American Academy of Allergy and Immunology, said this whole hypothesis is speculative and unproven, but they talked about Candida allergy. Now, let me go back a minute. A Japanese physician named Iwata in 1968 and 1970, 72, and 74 isolated a toxin. Do you know what a toxin is?
Yes.
A poison. That this Candida put out a poison, and he injected it into mice. It caused suppression of the immune system, irritability, paralysis of the extremities, irritation of the eyes and ears. More recently, and we have the paper I gave you earlier, Whitkin from Cornell University, studied women with recurrent vaginitis, and he found out that they had suppression of the immune system and in turn interference with the hormones, the endocrine system. So the reason that this Candida causes problems, it grows in a local area of the intestinal tract of the vagina and then puts out something in the circulation. It's very much like the story we were talking about. Two stories quickly. A little boy who has a skinned knee in a horse barn almost dies of lockjaw because the poison spreads through his system. Or the person with diphtheria who has a dirty gray membrane on their throat and dies of heart disease. Something spreads through the bloodstream to another part of the body. So this Candida, growing in the intestinal tract or overgrowing because of antibiotic drugs or high sugar diets, puts out a toxin that spreads to the brain and other parts of the body.
Okay, now Carolyn, how can we avoid, for children particularly, being treated with antibiotics, children who have colic, earaches, thrush? That's a new one. I never heard of thrush before. What?
It just is a word for candida growth on the tongue, usually of children.
But it ulcerates a bit, doesn't it?
It can do, but usually it's
Not
just
usually.
a white
It looks
coating
like
on
clabbered milk on the tongue.
No, I just wonder, you know, some antibiotics are more yeast-inducing than others.
Usually,
what do you do with children?
It's a difficult question, Harry, and you don't want to tell people don't use any antibiotics because certainly they've saved lives. I mean, they're very important. But I'll tell you some stories. One of my cases, I had a 10-month-old boy come in, and he'd been on, I think, 7 courses of antibiotics in his brief 10 months. Yes. He was born with a discharging ear. His mom, who was a nurse, smelled yeast from this discharge and told her doctors, oh, well, no. And every time the child became irritable and hard to manage, no fever, nothing else, just irritability, off to the doctor, look in the ear's pink and irritated, maybe red, and on another antibiotic. Finally, she came to see me, and I took the history, saw that the antibiotics really hadn't been doing much, suggested, she was still breastfeeding, suggested a yeast-free diet for the mother, acidophilus for the baby, and a few other small therapy things. And I don't think the child's been on an antibiotic now for the past 6 months. And so what I saw there was a yeast-caused ear infection. Now that's not to say all of them are, but you have the case where children will have ear infections, they'll be screaming, they'll be in pain, and what do? We're finding more and more that they could be allergies. I guess it's a matter of supporting the immune system. This is what you were getting to. You know, do we keep beating these yeast over the head, or do we take it as an attention-getting device of the body? It's like a kid always wanting attention. It's trying to get our attention that there's something out of balance. And that out of balance is people being out of touch with their body, for one thing, not knowing that what we eat, what we put in our body has some effect, not realizing that we need to sleep a certain amount, we need to exercise, we need to quit working so hard and pay more attention to ourselves. So I think I
That's
think
a
there's
fairly
balance.
tall order, you know, in
Well,
this day of achievement. And,
oh, yes, tell me. But, okay, but look around us. What we're getting is more and more viral infections. Epstein-Barr virus now is attacking people. Viruses are taking hold. Yeasts are taking hold. I think because for years we've been thinking the culprit was bacteria. We're great at killing off bacteria, but we flipped the whole internal environment around, and people are more and more susceptible.
well, you know, people do want instant cures. I mean, I don't want to have pain another minute.
Right.
Cure me, doctor.
Right.
You know, I'll make a deal with you.
Okay.
You know, here's
Harry, I want to go back to support some of the things that Carolyn had to say about antibiotic drugs. Now, antibiotics are life-saving. They cure many, many diseases. And I wouldn't want any one of your viewers to tell their doctor that their child has pneumonia or a severe ear infection of piolitis. Don't give my child an antibiotic. I heard the doctors on speaking out say not to. Now, but even the most conservative physicians in North America will tell you that 80 to 90% of the fevers are caused by viral infections that get well by themselves. I personally believe, if you, like Dr. Pauling, if you give a lot of vitamin C and liquids and a 2 or 3 days tincture of thyme, that they get well. But if you take an antibiotic drug, particularly a broad-spectrum antibiotic drug, at least take the acidophilus, as Carolyn mentioned.
Yes.
But then my grandchildren, when they have an antibiotic drug, they take some nystatin. Nystatin is the safest medicine a doctor can prescribe, and there's no reason not to give it with an antibiotic.
it only
drug.
goes for the yeast, doesn't it?
That's right, and
Leaves
it's not
everything else
absorbed into the
alone.
bloodstream. It's been used for 30 years. When I compare it with a lot of other drugs, why, it is safe. So when you need an antibiotic, you need it, but don't demand for your doctor. Don't just say, I'm going to a football game this weekend, I've got the flu, send me some antibiotic drug.
Now it's your turn. On the telephone, put questions to our guest. The number here is 482-5600. And remember, we do accept your long-distance call. Our area code's 416. If you're calling us long-distance collect, please place the call to an operator. 416-482-5600. 482-5600. Area code 416. Let's hear from you right away. The 20th century. Imagine a child at 10 months having 7 separate courses. What is this environmental ecological illness? Go ahead.
Yeah, I'm a student of Marshall McLuhan, and what they say about our electric environment right now, well, what Marshall said is that he called it discarnate man, where we're separated from our bodies because we're extended out through our central nervous systems. Our nervous system is like electric. I mean, there's a reason why they call it burnout. Burnout, we're burning out our electrical nerve endings. Mm-hmm. So when we feel separated from our bodies, I mean, the television viewers see our image. We're everywhere right now. When you feel separated from your body, I think you do all kinds of strange things to it. You treat it as if it's not real. You give it chemicals and drugs. I mean, we're the most chemicalized society, where everything we drink, we eat has chemicals.
Instant gratification.
And, well, that's, yeah, for sure. And then the other part of it, in trying to get our bodies back, people are exercising. They're coming to doctors who want to treat them nutritionally. I'm not asking for more patients. I didn't say that to demand more patients, but people are going to naturopaths and chiropractors to a greater extent to try to get back in touch with their body because we feel so cut off. So I think there's a hidden ground. It's not just all super achievement. We're sped up for a reason.